Hello, everyone, and thank you for following me on LinkedIn. This is going to be my first vlog or video log, and I'm going to be keeping you informed on the biopharmaceutical industry, especially in the emerging biopharmaceutical space. And as you know, I've been interviewing several executives uh, for applied clinical trials as well as for pharm exec in the emerging space, and we've been talking a lot to pharmaceutical executives, but what I want to do is take this and go towards the venture capital side and sort of ask them some questions around the challenges they go through and how they go into selecting and evaluating risk for emerging biopharma companies, as well as selecting them. So why don't you come and join me? I'm here in Silicon Valley. Again, we're going to talk to Ken Shimokawa of G4S Capital. So come in and join me and let's see what he says.
So first of all, we want a new drug, and which is not currently present in the world now. So a new mode of action, new modality, or a new way of thinking, like a new technology, like a cell therapy, gene therapy. Those are the new things recently, and then that is our target. And also, our G4S Capital is planned to try to establish focusing on the aging or aging associated disease, which is like a dementia, and then like a ophthalmology or the hearing loss. That type of thing that we are, at least I'm aiming to. You know, most of the asset is coming from the research organization, especially academia. And we have to have a certain exclusive IP to start with. Yeah, that is always the requirement. I think is the new technologies game, like a cell therapy, IPS, gene therapy, and digital health. You know, those new things is coming up about the same time, and then that is really driving up the changing the world actually. Yeah. So I've seen many of the digital health like therapy. You know, sometimes they just doing an application form. You know, just make a phone or something. But some companies actually doing the clinical study using the app. That is, you know, changing the way of the IT persons coming into that field. Mm-hmm. Right, and then that's really changing, and the new CAR-T, new science, mm-hmm. Those types of things are really changing the world. This is actually depending on the VC strategy, because my fund will be the early stage investor, so probably not the seed stage, but Series A, Series B. Like a preclinical to like a transition stage preclinical to clinical, or the clinical study, the early clinical study. That is our aim because of the size of the fund. But some VC has a bigger fund, and those people, those firms, tend to come in late stage, mm-hmm. or even early stage, but tons of money put in to support. It's kind of hard to predict the ROI in this case, but sometimes we want this science to be successful, that, and also the people who managing that science is who is doing this, mm-hmm. And what the team of this. So those factors actually makes the probability of success higher than just randomly invest. Mm-hmm. Yeah, well, science is important, but also the people who manage is important. So you have to have